So before we talk about the innovations, let us quickly take a couple of questions here. There is a reader who wants to know how Corona second wave is different from the first wave in terms of bed availability. I think that's quite a genuine question. I think most of the readers would certainly, the fear is there, so they definitely want to know about it.
The second wave is what we find is more people are getting infected. As in, I think the level of infectivity seems to have gone up. So the number of people getting infected, for instance, earlier there was one person in a family getting infected. In this second wave, we find more members of the family getting infected. So it's coming in clusters. So that's the not very happy part, and that's the reason why we have the numbers going up so much. The happier part is the second wave seems to be clinically less severe. So earlier, if we had more people who needed admission. Earlier, we had more people coming up with more severe clinical symptoms. This time round, it is less severe. So that's a big positive. Not everybody needs to come to hospital. This percentage of people who need to come to the hospital is actually quite small. And in terms of availability of beds, we still have beds. The health authorities have actually made a lot of provisions to make sure that everybody who needs care in a hospital will get care in a hospital. We also are taking a lot of precautions to make sure that those who can be managed at home, there are home care services available, so we don't clog up the hospital. Anybody who's asymptomatic but testing positive can also stay at home with, you have online facilities to consult doctors so that you are monitored.
Right.
At the same time, you're not, taking up a bed which a more deserving patient needs. So I would say it's a little different. The fact that we have more numbers is a little alarming. But the good part is these more numbers are not severe infection. So to that extent, the disease burden which has to be treated in the hospital is still not going out of control.
Okay, so things are still under the control. Now, since we're talking about, the bed availability and what, the kind of things hospitals are gearing up with, Dr. Narayani, would you like to talk about, the